Welcome to our interview series from the Community of Practice for Global Health R&D, a joint initiative between the Global Health Center at the Geneva Graduate Institute and the United Efforts for Innovation, Access and Delivery. Today, we spotlight EspeRare Foundation, a not-for-profit organization based in Geneva, Switzerland, dedicated to developing treatments for rare diseases in children. EspeRare fills critical gaps by merging scientific expertise, patient advocacy, and collaborative partnerships to improve access for underserved patients. We spoke with Caroline Kant, Executive Director, and Sebastian Matsuri, Prenatal Platform Development Director, to learn about EspeRare's collaborative approach. Collaboration is at the core of EspeRare's approach to developing innovative treatments for rare pediatric diseases. In this video, Caroline explains how EspeRare brings together patient advocacy, research expertise, and industry resources to overcome challenges, drive innovation, and ensure treatments reach the patients who need them most.
EspeRare is a non-for-profit drug development engine, so we really focus on accelerating the development of life-changing therapies for rare diseases, and we don't take care about the commercialization. Having said that, as a mission-driven organization, the final goal of enhancing accessibility and responsible development of treatment is in our DNA. So we tackle this very big challenge through various mechanisms. One of the mechanisms is that when we de-risk the development of the treatments we rescue far enough, then we attract a commercial partner that will be responsible of co-developing, funding the late stage of the development, and then the commercialization. And what we have innovated in the rare disease space is that within the license agreements that we put in place with our commercial partner, we embed ethical commitments in terms of accessibility and data sharing, so that we make sure that we align the mission-driven approach that we have initiated and transfer these commitments to our commercial partner. Because central to the model of EspeRare is that with philanthropic and public funding and our pharma know-how, we start de-risking the development of those treatments for our commercial partners. So we also ask that our commercial partners then also integrate in the way they commit to commercialize the treatments, these commitments for accessibility. Having said that, it's not a magical solution, and we also have to work on other levers to aim for this goal of equitable access. Other lever that we integrate in the way we develop our treatments is to work hand in hand with the patient community in terms of right at the start of the development of the treatments, making sure we integrate the voice of the patients in the choice of the treatments we develop, so that we make sure there will not be an incremental health impact, but really a transformational impact that will justify pricing, that will justify reimbursement, and that will ensure that we maximize access. The other thing we do with patient organization is that in parallel of the drug development, we onboard them to make sure that we have a very data-driven approach to drug development. So we make sure that we support the patient organization to collect the right data so that we enhance the understanding of the burden of the disease, and we anticipate that we can help also our commercial partner making the case for a reimbursement in terms of cost saving for the healthcare system. And the third lever that we try to influence, it's all about advocating for policy making priorities in terms of going towards healthcare system that will prioritize transparency in terms of healthcare outcomes and in terms of accessibility. And this is also linked to the new data-driven era in medicine, where we can more and more move towards predicting the outcome and the impact, not only on the patient itself and its support system, but also in terms of the impact, the positive impact on the healthcare system. So that we make sure that these treatments at the end of the day are priced in a way that is a positive outcome for patients, the healthcare system, but also that it's sustainable for our commercial partners, that at the end have to have a long-term commercial model in terms of the sustainability. And the more we go into advanced therapies and in rare diseases, this is also where the space is going, is much more advanced and precise therapies that most often target specifically, for example, the defect gene, which also increases the efficacy of the treatments. But the downside is these advanced therapies are very expensive to develop, to manufacture, and then to distribute. So it's really about the bearable pricing for all key stakeholders. And EspeRare is really trying to, as we go, adapt our model so that we can really align all these challenges, but all of these outcomes. It's a positive outcome for the whole ecosystem.